Department of Veterans Affairs plays in responding to this global crisis. We've got two journalists with us on the line today who also analyze veterans issues for VHPI. Suzanne Gordon, is Suzanne on?
Yes.
Okay. Suzanne Gordon is a VHPI senior policy analyst, journalist, and author of Wounds of War: How the VA Delivers Health, Healing, and Hope to the Nation's Veterans. Her work has appeared in the New York Times, the Boston Globe, the Washington Post, the Nation, the Atlantic, Washington Monthly, the American Prospect, British Medical Journal, and many other publications. Also with us is Jasper Craven, who is a journalist based out of Brooklyn, hunkered down in Brooklyn. His work has appeared in Politico magazine, the New York Times, the Boston Globe, the Chicago Tribune, the American Prospect, and many other publications. Suzanne and Jasper, could you tell us a little bit about the role the Department of Veterans Affairs is supposed to play during a crisis like the coronavirus pandemic? What is the VA so-called fourth mission? Jasper, would you take it first?
Yeah, sure. Thanks everybody for coming. So the fourth mission has sort of been elusive in the public mind for many years, but is now a fairly commonly held fact in the press. It's received a lot of attention. Essentially, this mission is to act as the emergency backup health system in times of emergency and pandemic, essentially when the private sector civilian health system becomes overwhelmed, as we are currently seeing it is across the country. The VA's work to prepare for various types of emergencies really ramped up after 9/11, when each federal agency sort of started planning for a number of various contingencies, whether that was, a poison attack like we saw with anthrax, or some sort of like bioterrorism. In 2005, with the H1N1 pandemic, the VA took a lot of really aggressive steps to create a plan to plan for a pandemic specifically. They modeled their plan based on what happened in 1918 with the Spanish influenza. This work was incredibly detailed. As best I can tell, I think it was actually spearheaded in Florida at the VA's Sunshine Health Network. I just spoke to one of the chief planners of that plan a couple days ago, and I'm actually going to just put in the chat right now the national plan that developed from that. If you can go in the chat, you can read it. As you'll see, it's incredibly exhaustive. It's 140 pages long. It deals with everything from creating an emergency communication strategy to notify vets of the challenges and dangers with a pandemic, as well as, sealing off hospitals, making sure they were safe, making sure that infection was controlled, all of that sort of stuff. Unfortunately, based on what I heard from this administrator in Florida, the plan was created, but in his vision, it wasn't fully executed upon. So he wanted, for instance, to create more VA space for storage, to create extra supplies in case of a pandemic. That was shot down, at least in his vision. He asked, as he recalled, for $11 million to help plan for this, and said that he only got $1.5 million from Washington. So unfortunately, while the plan was created a long time ago, not everything was delivered upon. And that, I think, sort of is now being seen in some of the challenges VA is experiencing.
Okay, thank you. Suzanne, you want to add to that?
Well, it's interesting to me that suddenly everybody's discovered the VA, who's been bashing the VA for about, as long as I've been writing about VA healthcare, which is about 10 years. And I just want to say to I don't know all the folks who are on the line, I really appreciate you being on the line, but if they're veterans, caregivers, administrators, staff, I just want to begin by thanking you for the work you're doing. I mean, people are really putting themselves, they're at risk on a daily basis to care for not only veterans, but all patients. And again, Jasper's talked about the fourth mission. And I think it's interesting that suddenly a lot of people in Congress or in the media are suddenly discovering how important the VA is not because of the fact that it's supposed to care for veterans, which is its first mission, but because it's supposed to care for all of us if we get in trouble. You know, the only way it can care for us if we get in trouble is if it cares for veterans and has the capacity. I mean, if it can't care for veterans, how can it fulfill its fourth mission? The fourth mission, so the first mission is caring for veterans, and the VA teaches its missions include teaching. It teaches most of the many of professionals in training. It's the biggest research powerhouse in the country. And then it has the fourth mission, which is helping in national emergencies. I particularly have experienced the fourth mission several times when I was once the first time in Hawaii when the Big Island's volcano erupted, and the VA there went into immediate action to reach out to veterans and other people who were in trouble because of that eruption. In San Francisco at Fort Miley, I sat in during the wildfires of 2018 and 19 in their command center, where they were reaching out to their patients. They were doing something no private sector system did, was reach out to patients to find out if they had medication, if they had medical equipment, if they can make it to their appointments. I have to tell you, nobody called me about these wildfires ever, and the VA was not only reaching out during the fires, but several weeks after the fires. So this is something that they take extremely seriously, and of course now they're being asked to take care of civilian sector patients in places like New York and Louisiana and all over the country if private sector hospitals can't handle it, and we know that many can't. The problem, of course, is if you have estimates that you will have 20 to 40% of your staff. So the VA has about 300,000 employees. If 20 to 40% of your staff, particularly your clinical staff, but not only your clinical staff, your support staff, are expected, as they predict, to be out because they're quarantined, because they get sick, because they have to take care of a family member, whatever, or a family member gets sick and they're quarantined, you have to have really be a fully staffed system. And the VA is now lumbering under about 50,000. We don't really know the accurate number, about 50,000 vacancies, and that's a real problem.
What led to this shortage of staff, this staggering 50,000 shortage?
Yeah, there's a number of factors. I mean, there has always been a problem of recruiting and retaining staff at the VA. We have the VA has very cumbersome hiring processes. They have shortages of human relations staff, medical staff office, the people that credential clinical staff. They have problems. So they have problems sort of backfilling when there's a vacancy, or somebody retires, somebody dies, somebody leaves for another job. It's way too complicated to go into in this short form. We are doing another report, Jasper, Craven and I, a much longer report on the staffing crisis, which will explain a lot of this. But they've had problems for many, many, many years, but under the Trump administration, these problems have really been exacerbated. And there's some places that are worse than other places. I mean, for example, it's extremely hard to recruit to rural areas. I want to just backtrack. So some of the problems that the VA has in filling vacancies are problems that the VA can't solve alone, because they're problems of the broader healthcare system. We have a shortage of something like 45,000 primary care providers. We have shortages of mental health providers. 55% of American counties, all of them rural, have no psychiatrist, social worker, or psychologist. So there are problems that the VA is dependent on the supply of healthcare professionals that our country produces, and we don't produce enough of critical in certain critical professions. The VA is also hampered by the fact that it can't offer often competitive market rate salaries. That's a long-standing problem, and that all of these problems could be solved, and we'll discuss that later. But I think under the Trump administration, what Jasper and I have found is that there's been a really significant exacerbation of these problems. We found that in some VISNs, these are Veterans Integrated Service Networks, that's the kind of regional organization of the VHA. There's been very punitive management, people driving people out. The Congress and the media have not helped at all, because pretty much everything you read in the papers about the VA is negative, and that doesn't enhance morale. And so, and Congress and the media have ignored all the studies that show that the VA delivers very high quality care, often superior to the private sector. So we have, staff demoralized by in some places, punitive management being driven out by the media and Congress. And also, there's been, and I think Jasper's going to talk more about this, there's been a problem with the focus on really kind of employee bashing rather than supporting employees who are doing amazing work. And finally, I think that this administration has been devoted to outsourcing patients to the private sector, not strengthening the Veterans Health Administration. And VHPI has pointed this out for a number of years now.
Thank you. Jasper, if you would discuss the factors that are external to the VA that may complicate ensuring that the VA was just not ready for this pandemic. I'd like to note that we have Bonnie Graham, the director of the San Francisco Medical Center, on board, and we will ask her shortly for her input on these issues. So go ahead, Jasper.
Yeah, absolutely. I mean, there were a number of actions taken early on in the Trump administration with regards to the VA that have complicated its ability to respond now. I think chief of which is the VA Accountability and Whistleblower Protection Act. This was a bipartisan bill that was hailed as sort of creating this office that would protect whistleblowers with legitimate complaints and sort of ferret out bad behavior at the top in order to punish corrupt managers. Instead, over the first 2 years of this office being established, thousands of frontline employees were put up for termination, suspension, or other punishments, often for fairly minor infractions. This could include, a veterans benefit administrator missing their claims quota by a slight margin and then facing termination. What this did was not, there's the issue of retention and recruitment and that vacancy number, but what this office did was just gut the department even more by pushing out thousands of employees. I'd note that there were at least 2,000 of the employees targeted in various housekeeping, janitorial jobs, which, as we all know, are now incredibly critical to ensuring that VA hospitals mitigate the spread of this virus. And so the VA now is putting out this call saying we need to hire housekeepers incredibly quickly to ensure that hospitals stay clean. And yet, as we saw over previous years, the VA was purging the VA of housekeepers. So I think that's a fairly illustrative example of how Trump's crackdown on labor is now really hurting the ability of the department as it deals with this unprecedented crisis.
I'd like to, Paul.
Yeah, go ahead.
Well, I'd like to add that one of the things that we've found in our in our research was, and in our investigation in the American Prospect, was that there's this kind of what one top VA official called big lie, that we have enough money. And Trump added more money to the VA budget, but if you can add enough money, you can add more money and still have enough. I mean, if you need 100 billion and you give a budget of 80 billion, you know, that's nice that you gave 80. It still might be more than you had before, but it might not be enough. And I think that's very much important to remember. And I think the MO of this administration is to say, we don't need more money. I mean, I just spoke with a very top VA central office official who said that the message that is constantly being given out is that you are not supposed to talk about things that we need. You're not supposed to talk about the fact that we don't have enough money. What you have to say is everything's all right. And this is what the Wilkie is saying. We have enough. If we have enough, then how come, as we found out, 14 out of 18 visits are in budgetary crisis? How come there's hiring freezes? They call them pauses at many facilities, and they can't fill these vacancies. And now we have the coronavirus. So there's a real problem with an administration that is determined not to go back to Congress to say we need more money. And, you know, this is a real problem when you have a national emergency like this. I think it's really important for people to understand that veterans, I mean, you not only have an emergency because the VA is being expected to care for people, private sector patients, but veterans are particularly at risk for this virus, for hospitalization and death, because the people who are most at risk for COVID-19 are people who are older and people who have underlying health conditions, and that defines really many of the nation's veterans. The Mission Act has really complicated things because there was so much focus on outsourcing veterans to the private sector, and really not, as I said before, not on strengthening the VA. Between 2014 and 2017, for example, the budget for outsourced care increased by 49%. The budget for clinical care inside the VA increased by 9%, even though we had more and more veterans seeking care from the VA. Wilkie, I can't remember when, Jasper can perhaps help me here, but I believe it was in 2019, Secretary Wilkie was lauding how many patients 3 million patients sent out to the 3 million appointments in the private sector, or was it 1.5 million? It was 1.5 million in the private sector, but 3 million more appointments in the VA. So that means you have more people coming to the VA, and you still have this vacancy problem in many areas.
Thank you. So even with these long-term challenges that the VA has, how has Secretary Wilkie and President Trump's second VA secretary addressed these issues, particularly with the 50,000 vacancies since he was sworn in 2018? Jasper?
Yeah, well, as Suzanne touched upon, Wilkie has not prioritized the vacancy issue. He seems most focused on rolling out the Mission Act, which is sort of the largest VA privatization law in the department's history. And so when he was asked last year, for instance, in front of the House Veterans Affairs Committee, how he planned to address the 50,000 vacancies across the department, his answer was essentially, I wouldn't be honest with you if I were to say this was a top priority for me. We need to, you know, sort of like focus on rolling out this massive VA Mission Act. We need to focus on updating the department's IT system. This just does not rank high upon his list. And in fact, in some press reports, he has actually offered false data suggesting that there's only a couple thousand vacancies rather than as many as 50,000 or more. And so it's something that he does not seem to be taking seriously at all. You know, the administration in general doesn't seem to be taking a lot of pressing issues in the VA seriously, especially now with the coronavirus. Wilkie has been incredibly mum on what's going on in the VA. He has been denying reports that PPE is an issue. I mean, clearly all manner of reporters are hearing, including folks at the Wall Street Journal, a fairly conservative publication, that the VA is struggling with protective equipment and for gear. I mean, I've been speaking to union officials who say that they're being frozen out of COVID-19 plans. And so therefore their nurses are being put on COVID shifts without proper training. They've also, the union has lost all official time as well as office space. So they're just not able to sort of function in this key way to back up.
What union is that?
The employees have lost all official time, which essentially means that the VA no longer gives them any time on the clock to do labor work. So this means that they can't have an employee come to them during the day in their office, because they've often lost their office, to say, hey, listen, I've seen this. There's a problem here. We need to deal with this corrupt manager, or we need to fix a safety issue on this floor. That's just not happening as much anymore. Labor also isn't able to go to patient safety meetings as much, or to go to resource management meetings where decisions around hiring are made. So the sort of the key critical voice of the clinicians doing this work are being frozen out. And the Trump administration therefore doesn't hear what's going on, probably willfully. They don't want to hear some of the issues. They don't want to address them. That's not to say there aren't a lot of really fantastic people at the VA in high ranking positions trying to deal with this, trying to shift resources, trying to keep people safe. I mean, there's generally a pretty strong reputation for Dr. Richard Stone, who is the executive in charge of the VHA. Yet, he's still an acting official. The Trump administration has not filled very critical, high-level VA roles, and therefore, leadership at the top is also confused, and it's not as streamlined as it could be. Because of this, we are seeing VA employees get sick, as Suzanne mentioned. They estimate that maybe a third roughly of the workforce could be out for various coronavirus related reasons. And we're also seeing veterans get sick. I mean, the numbers, which I will post in the chat, are concerning and tragic, but they're not necessarily, and probably not actually at all, an indication of the VA failing to deliver care. Even amidst all of the struggles, VA employees are taking a lot of risks and delivering world-class care to ensure that they can treat people as best they can. So, I mean, the veteran population is relatively, is generally sicker than the civilian population, generally older. I mean, there's a lot of comorbidities that make them very susceptible to this virus.
Okay. Thank you.
Can I just add something there? I mean, what's interesting and what I'm really concerned about, I mean, I've heard some amazing things, and I think, Paul, you may be going to read something, or somebody's going to read something that a veteran sent in about the VA reaching out to them. I've heard amazing things about what the VA is doing to help people, but, I think that what I'm very concerned is that the media could kind of spin any little hiccup that the VA has into some kind of, oh, the VA fails again. And I think, once again, you're seeing what we've seen for years, is that the people who are writing about veterans healthcare don't know anything about healthcare. I got a call from a reporter from a very prominent outlet, and he said, I'm a business reporter. I know nothing about healthcare. I know nothing about the VA, but everybody's been assigned to the coronavirus now. And he was saying to me, he was writing something about the Manhattan VA. And he said, why do they only have 100 beds, to help people in New York? That's hardly any beds. Well, I mean, first of all, people have to understand that the issue, and Bonnie knows this really well, the issue is in beds. I mean, I could put a bunch of beds in my living room, it's staff for the beds. Every bed has to have X amount of staff, right, to take care of the person in the bed. It's not about beds. And, it's the same issue with the personal protective equipment. The VA is dependent on the supply of personal protective equipment, on the supply of swabs for testing that the society produces. And if we're not producing that, you can't get this stuff by turning on a faucet.
Well, I think this is a good place for me to bring Bonnie Graham on, who's the director of the VA Medical Center in San Francisco, and ask her that particular question. How much staff does it take for a COVID level ICU or critical care patient to fill a bed? How much staff is taken for that? Bonnie, if you could come in, that'd be great.
Sure, can you hear me?
Yes, thank you.
So I don't know the answer to your question. That's not how we look at it. If I can share with you, if I had my chief nurse in here, she could tell you, but I'm not aware of that information. It's been interesting listening because this is certainly what I hear nationally and what I hear on the news. But I wanted to be able to share what's happening here because I think the VAs all operate independently. And what you hear about one is not necessarily about what happens at another. Fortunately, we have the opportunity to plan. And the fact that San Francisco had shelter in the home so early, and the state as well following, really put us in a very different position that allowed us to plan. So we've had an incident command operation up now for 2 months. And they meet several times daily, looking at and addressing a lot of the issues of what you were talking about. But to just give you a sense of what we are doing for our veterans and then how we are planning for the fourth mission of emergency management, let me share with you a little bit about our beds because that's really important. So we have 120 licensed acute beds and 120 licensed nursing home beds. Right away, since the nursing home is the most vulnerable population, we essentially set rules that no visitors, people can't go in and out that don't belong there, a lot of details. And we have not to date had any positive residents in the nursing home. We intentionally dropped our bed census from 120, it's now down to 52. And that was intentional in helping us plan for a potential surge for the veterans, which of course are our first priority, but then also if we are called in to assist others in the community. And so to date, we've had 4 positive veterans in the hospital. Unfortunately, 2 passed away and the others have been discharged. We have 5 PUIs, which are being tested. We have 5 positive outpatients.
And
I'm
PUI?
sorry.
What is a PUI?
That is potential under investigation.
Okay,
So they've been tested and we don't have the results yet.
Right.
But we treat them as if they're positive until we know otherwise. We have 8 employees who are positive. That number hasn't changed for the last 2.5 weeks. Part of how we got our census down so much is we have no elective surgery. We're just dealing with urgent and emergent surgery. You talked about the Mission Act. The Mission Act is on pause. And so we're not sending people out into the community unless there aren't other alternatives. Prior to the pandemic, San Francisco had 6% going out into the community, which isn't much different than what we had before because we don't provide every single service. So that hasn't changed much. You also talked about deploying people.
Could I ask you a question there? And you may not be aware of this, but the numbers we're hearing of outsourcing is quite a bit higher than 6%. Not for the
Not in San Francisco, not in our area.
So it's
And that has, I think that has a lot to do with, we have a formal outreach office and we're doing a lot of education and reaching out to veterans, not only during normal times, but certainly during these times. I'm getting a lot of emails and calls from veterans daily. I had one veteran put something on Facebook that said that one of our medical support assistants reached out to him to check on him to just see how he was doing. And he said, well, this never happens. Has it happened for anybody else with other health care? And so things like that, I think, are drawing people to stay with us.
Yeah, that's great. Is that out? I mean, and Suzanne talked about it, that about after the fire, you had a whole group of people that reached out to veterans that might be affected by it. But is this outreach program system wide, or is this something that just you or a few other medical centers have?
So what I'm speaking about is what we've done in San Francisco.
Okay, thank you.
And so my point being, it can be done. And so I'm not being stopped from doing these things.
Right.
And I have the budget. I have received money for the pandemic. I actually just increased for all our Title 38, which are the nurses, the therapists, the respiratory folks, a lot of the clinical people, a 10% retention bonus during 60 days. And the same with Title V, which are your more administrative, non-direct care people, the same thing. We are actually hiring a ton of people because they're available, because they're being laid off in the community. And the VA, and this is national, waived a lot of the HR processes that, to be honest, have been so bureaucratic that we can hire nurses very, very quickly now. And I'm curious, I think there might actually be a lot of good that comes out of the pandemic, believe it or not, because I think people are not going to be accepting of returning to processes that were in place before. So you talked about housekeeping. That's been a challenge of ours for a long time because of the high cost of living here. People commute 2 to 3 hours one way. We now have more than doubled our housekeepers, and we're working with community organizations who do the training and feed them into our system. And we have new ways to hire them now because other processes were waived. And so there's a lot of things like that that are now in place. I wanted to just mention the DEMPs and deploying people. And so we haven't had a huge positive population yet, but I'm not convinced that there won't be another spike.
Right.
And so I have the authority to approve or disapprove people who want to go elsewhere to help. And so I feel at this time, I need to keep people here. We have expanded our beds. We normally have 18 ICU beds. And with a surge, we can now increase that to 72. We can increase our med surge to 151. And so in some of these cases, the beds are critical because they either need to be negative pressure rooms and different. We've done all that work already. So we're prepared to receive those patients. And with that, we have a staffing plan. So we have sufficient nurses and other folks. We've had to spend a lot of time cross-training people. So people who don't usually work in the ICU, but work on a med-surg unit have been cross-trained and they're prepared. We have over 50 administrative volunteers who have been trained to be runners, to deal with logistics, to do all sorts of things that they can do to assist. And so, and then also we have a supply surge plan, and we have our equipment, we have our PPE, and we continue to look at that. We have a lot of innovative researchers here. Some of our physicians use 3D printing for orthopedic surgery, and they're now printing face shields, and a variety of other things to assist us. So my point in sharing all of this, I think it's really important, even though those limitations you all mentioned that I know are accurate. We have authority locally to make things happen, and everybody in San Francisco is just really stepping up to the plate, and it's been unbelievable.
Yeah, the VA Medical Center at Fort Miley is where I go in for service, and I've always been uniformly impressed with the quality and the commitment that everybody shows there. So I really want to thank you and everybody there for the incredible work you do. We are, however, still concerned about how things are going elsewhere in the country. Do you have any comments about what your understanding is on the situation nationwide? I wouldn't want to put you on the spot here. I understand you have to be careful, but
so I hear, because I'm on our VISN calls, which are our Veteran Integrated Service Network. Even, there's the 7 facilities within our VISN. We're all prepared differently. And so I think there is probably great variation throughout the country. And there's also great variation in the extent of the positive COVID population. And so I think it really, really differs.
Yeah. Suzanne, you want
to... Yeah, Bonnie, thank you so much. I just want to say that I feel like I'm not a veteran, I'm not a patient. Let me tell you, I wish I could be a patient, and I wish I was a veteran, and I would go right to San Francisco VA. I know exactly who I would choose as my primary care provider. And Bonnie probably knows too, and I've actually gotten some like, I really think that, the San Francisco VA is one of the great VAs in the country. And, I think we have to look at facilities like the San Francisco VA healthcare system when this is all over, and see what these best places in the VA do when they can do it. And that should be the model for the VA, not the private sector.
I would certainly hope that would be the case. I was concerned for our employees, and I wanted to do everything within my power to help support them and help them support one another. And so you, of course, know Keith Armstrong and John McQuaid, and they co-chaired a disaster mental health committee and came up with amazing resource and handouts. I'm happy to share with anybody. I've been sending them throughout the VISN, through the state, through the California Hospital Association. They published them, I think it was this week. And just looking, to me, that's a best practice. What they came up with was amazing. How for frontline to take care of one another, how supervisors can do that, and just self-care. And it was just amazing. So I think things like that, I would hope would become best practice.
Yeah, I just want to say that, I think that Jasper and I have written also another article for the Prospect about why having a healthcare system like the VA, a national healthcare system, is so important in a crisis like this. And Bonnie mentioned, being able to move staff around and sort of cross-train people, and the VA being, canceling elective surgeries. And I spoke with another leader of a facility that she requested anonymity, but she was saying that in her region, the VA was able to immediately halt elective surgeries and move staff around, but where private sector hospitals were very reluctant to do that because they were losing money. And you see in private sector hospitals, nurses and doctors being furloughed, who could be, for example, PACU nurses, recovery room nurses often are critical care nurses who sort of burn out and go into the recovery room. To furlough a PACU nurse is insane. you know, because they can be moved into critical care, but a lot of hospitals are doing that because they're a fee-for-service, you know, system, and the VA has a budget. I mean, people are paid whether they do knee replacement operations or are in the PACU or not.
People are seeing that there's great advantages to being in the VA now for exactly the reason that you're talking about. And because we don't have elective surgery, we have our OR nurses doing employee screenings at our points of entry. I mean, everybody's just pitching in, but we're not decreasing anybody's hours. I heard today that a hospital in Florida was asking people to decrease their hours. We're just not doing that, and we're just using people in different ways and taking the time to train. And we have so much telehealth going on. We were already the most advanced in that, and we have quadrupled the amount, and we've led the way in our vision for urgent care telehealth. So they are screened before they leave their house, and the majority of them don't have to. And so we're just making use of everybody we can, and they're thrilled to be having a job.
So I just want to tell two stories that, because I think, you know, before we move on, and I know we have to move on, but in the midst of this COVID crisis at the San Francisco VA, a friend's husband who was dying of dementia and chronic obstructive pulmonary disease, I got them to go over to the VA, and she told me that about a week after her husband was seen, she got a call from somebody on the phone, and it was the geriatrician who had seen him the week before, calling her up to see how he was doing, and she practically fainted, you know, because doctors don't call you to find out how you're doing. And we got a wonderful email from somebody in Minnesota who said he got a call from the oncology department asking him if it would be okay if he got his regular infusion at home, and the VA sent, so the VA reached out to him saying, can we do this at home? And he was just, you know, kind of knocked over, bowled over, and is getting the stuff at home. And you know, there's a means to do this. I mean, the VA has a telehealth capacity, but also they give their patients the equipment to use the telehealth, you know. I mean, you know, they'll leave with an iPad or a laptop or something like that. So, you know, while we have focused on some of the problems, many of the problems that need to be solved, I just, you know, think, and I think Jasper agrees, that people are just doing an amazing job because you have so many advantages.
Thank you.
If I can just share one last thing and then I'll stop so you can move on. I'm just thrilled with the community and the people volunteering. We had Microsoft cater 800 meals to our employees this week. We also had Verizon free of charge set up a system so our folks in the nursing home can use iPads and communicate with their loved ones who can't enter the nursing home. So we're just seeing lots of community folks stepping up to assist. It's amazing.
That's great. Thank you, Bonnie. That was very, very informative. We're really pleased that you were able to get on and help us with this, some of these questions. But we do need to move on. We really only have a few minutes left that we can keep going. So if I could ask Jasper to talk a little bit more about telehealth as a possibility?
Yeah, we could do that. I mean, if we also want to just open up the floor for questions because time is moving quickly, I think that might make sense. I think Bonnie gave a fantastic breakdown on sort of how the VA can react to offer telehealth to, you know, continue offering world-class care amidst this pandemic. So if folks have questions, maybe we just move on to those. What do you think, Suzanne?
Yeah, I think that would be appropriate. I mean, I think that the basic feeling that we both have, Jasper and I, and people at VHPI, is that you have to learn from the lessons of the pandemic. And the lesson of the pandemic is that the private sector in a situation like this is a mess. The private sector is also, delivers uncoordinated care in general. I mean, I, as a patient in the private sector, have to be my care coordinator in a way that Paul will never experience at the VA. And I think that the lesson is that if you want the VA to fulfill all its missions, you have to give them enough money and you have to give them enough staff. And I think one of the things we should learn, and I think Bonnie alluded to this, is that, the kind of fast tracking and hiring that's overcoming the cumbersome hiring procedures needs to be extended, past this emergency. We need to, I think, look at some of the provisions of the Mission Act and question the whole wisdom of privatization. Obviously you have to send some people out to the private sector, but not in the way that they wanted. Things like the interim staffing program, which I don't want to go into, should be reinstated. And we think that the Asset and Infrastructure Review Commission part of the VA Mission Act should be entirely repealed, as which this is a kind of a setup for closing needed VAs. And we're seeing now suddenly that every VA is needed, and every VA has something to offer the community. I mean, I would argue, okay, we have a national emergency with COVID, but we have a national emergency with rural health without COVID. We have a national emergency with rural mental health without COVID. We can't afford to lose VA facilities, right? Particularly in rural America, but really pretty much anywhere. So I think that our hope is that there's a reconsideration after the dust settles, when it settles, about planning. The VA is an example of that. You can plan, you can move staff around, about whether people should be on salary or fee for service. There's a whole lot of things we should reconsider. And I think finally we should, continue this sudden love affair with the VA, sudden discovery of the VA when this is all over. I mean, we shouldn't go back to, we shouldn't go back to the future. We should move on to a different future and to evaluating this, what I consider to be a national gem, and solving its problems. I mean, every healthcare system has problems. It's the largest healthcare system in the country, so of course it has problems. But I agree that we should move on to get questions. And I guess we can go past the hour if people want to. Is that not correct?
Yes, but I think we should try to keep it to an hour. My attention span is somewhat limited these days.
Right, but I think if people want to continue, we should cut some slack here.
Okay, we can.
If they want to leave, then
well, let's get to some questions then. So John Spitzberg has a question, which is, let me see if I find it. Is this the best time to continue to be solely concerned with the privatization issue?
I'm sorry, could you repeat that?
Is this the best time to continue to be solely concerned with the privatization issue? I think that Bonnie certainly has answered it to somewhat, that's not certainly her main concern at this point, but at the national level, is that something that seems to be continuing to be a real problem? And then in addition, there's the Air Commission, which is an issue that has to be addressed sometime in the next year or so, and we should not lose track that that's coming down the pike. The Air Commission, Assets and Infrastructure Review, it's kind of like in the 80s when they had the BRAC Commission to close down a bunch of military bases. And it's going to really evaluate whether the VA should dump a bunch of its property so that it can be developed, such as Fort Miley, great location for a big condo.
Yeah, I mean, when it comes to the privatization question, privatization reduced down is just a question over funding. I mean, it's where do taxpayer dollars go? Do they go to the VA to bolster care, to increase capacity, to update facilities? Or does that money go to the private sector? Now, this is a system that has said in its promises around VA outsourcing that it would provide all this data. It would basically let veterans choose which system was better. You could compare wait time data with the VA to the local private hospital. You could compare certain quality metrics from the private sector to the VA hospital, and then the veteran would have this choice of where the best place to go for healthcare is. Those two promises have been broken. The private sector is not putting out data on what care looks like inside their hospitals. And you even see right now, they're actually putting gag orders on staff so that they won't blow the whistle on problems arising in the private sector of relating to, of sort of blowing the whistle on problems around the coronavirus. So the privatization issue, yes, it may not seem sort of most urgent right now as this crisis is raging, but it really is critical to the survival of the VA. And if more money goes outside of the VA, what will happen is some facilities will struggle and they will slip up. And then what will happen is this cycle will continue where an anecdote is blown out of proportion and the argument against the VA is strengthened, and the VA will then lose more support publicly and it will lose more money. And pretty quickly you can see a future where the VA is totally decimated.
Yeah, I mean, I think it would be naive to think that privatization because of this crisis is taken off the table. I mean, President Trump wants to privatize the Postal Service. I mean, I think we have to be constantly vigilant. And I think those of us who value having a national health system of some form, if only to veterans, really need to look at the VA as a model for planning, a model for how you organize care, how you pay for care, et cetera. Personally, I think the VA's performance in this crisis suggests that we should be moving from Medicare for all to VA for all. But I think that we clearly, you know, people, and I think that the coronavirus crisis will have a huge impact on veterans and their families because people are losing jobs. When you lose your jobs, you lose your healthcare insurance. You become eligible for VA care because you now have a lower income. We have to look at the homeless. I mean, I think Michael Blecker's on the call. I'd love to hear from Michael about what he thinks about the impact of the COVID virus on the homeless, and the VA has had, you know, a significant impact on veteran homelessness and on homelessness, which means an impact on homelessness in general. You also, I think we need to look at, so how will the VA need to be resourced if more people are going to be trying to access VA care because they've lost their normal health insurance? I mean, there's so many questions that we as a think tank, VHPI, need to think about, along with the many people who help us think. Another issue that I know Swords to Plowshare has been dealing with is the issue of other than honorable, the other than honorable discharges. That should be immediately eliminated, and all those people who have these kind of discharges, we believe, should be immediately gain eligibility to the VA and retain it after the crisis is over. So there's this is an important moment for those of us who are concerned with veterans' healthcare and with healthcare in general.
So if Michael, if you'd like to say a few words on those several issues that Suzanne covered.
Okay, thanks everyone. The one thing about the VA is that they have, their docs are all connected with the docs who are basically doing, you know, working with low-income people in the community, right? You have the VA works and they share with in San Francisco, right, with the UC San Francisco system and San Francisco General. So that's the value of getting all that, you know, wisdom together and all that expertise together is very valuable. Right now, I mean, Swords are struggling with just trying to keep all the veterans who are formerly homeless or low income or, you know, in congregate settings, keeping them safe and trying to get them tested, right? That's the big issue. And can the VA maybe do a little bit more with testing? But that's a bigger, we like them. We'd like our staff to get tested, even if they're asymptomatic, because there was a big outbreak in one of the shelters, and a number tested positive, even though they were asymptomatic. And other folks serving homeless individuals, whether vets or not, are really pushing the city departments to do testing, right? And so it's a big push right now because, shamefully, there's not adequate testing. And that's part of, a bigger issue.
Yeah.
But I'm just saying that veterans can benefit from the fact that the VA is so tied in with all the top-notch expertise. But right now, as we said earlier, a vast majority of veterans who are vulnerable, right? They're a big part of who we serve. We serve 500 homeless veterans, right, in our housing programs. A vast majority are over 55. A vast majority have underlying health conditions. A vast majority have all these potential, they're vulnerable, but it's really difficult to get them tested, and we're struggling right now. But that's where the VA can play a bigger role. And that's the whole shortcoming of the entire system as a whole, is testing right now.
Okay. Yeah, I agree with that. And that's also speaks to lack of planning that, after SARS and COVID and MERS, that we didn't do anything to get ready for this is silly, is criminal, actually. So anyway, there are a lot of questions, and I'm completely jammed with how to even start to address any of them. So we have some questions. So let's John Spitzberg, did you have a question you'd like to ask?
We already asked a question. I think we need
Yeah.
to move on to somebody else's question.
Oh, okay. We've already taken care of you. All right. I think we are probably going to limit it to a couple more officially, and then the remnants can hang in there if they like. Dan Shea is on board and would like to say some things. Dan, would you please introduce yourself?
Yeah, I just wanted to add, that our local VA, I sent Suzanne our website for the Portland VA, which is put up a website that explains the fourth mission, which you talked about in the very beginning, which is very important. One of the things that happened in the very beginning, when people were beginning to talk about this, there were reports that fourth mission was taken off the VA website. A lot of us complained, and it got put back on. So the activism of veterans is very important, as we are with the Veterans for Peace, SOVA, Save Our VA campaign, which just did lobbying in Washington, D.C. in February. We were talking about a lot of these things about full funding. All of a sudden, the coronavirus comes, the Mission Act becomes very important, and we need to take real attention on that and take advantage of the opportunities that people are starting to see how well it is taking care of people and being a part of a national campaign for emergency. So one of the things I just have to talk about personally, I'm one of those people who is a type 2 diabetic, post-traumatic stress, and I've been having some problems lately dealing with, urination, and then a real worry about prostate cancer at 70 years of age. And I went to My Healthy Vet to, ask my primary if I could get an appointment. First, they were saying there was no appointments at this time. We'll put you in touch with your primary care team. And when I began to explain what I felt and worried about, the doctor called me. We discussed a little bit over the phone, and then they said, "Come into the clinic. We have it." There's very few people that even are able to come in. And so when I went in there was nobody there. I know 2 people were there, and they stopped me at the door, and then immediately I got in and had labs and talked with my doctor. So they are doing great work here in Portland, and I work very closely with also the Medicare for All, or basically in Oregon, it's Healthcare for All Oregon, which is a campaign, and I invited them to be on this call too. So I hope they would be, but I also noticed today that Senator Merkley had a conference call. Oh no, Senator Wyden had a conference call at the same time we have ours right now at Town Hall. Now the VA in Portland had a town hall meeting to discuss many of the issues about coronavirus. I missed that, but they did put up on their website the agenda that they went through and covered many of the things that you're talking about today. So I think it's important for people to know how to use the website, how to find things, and organize your own chapter and educate them on this. I hope that this video will be available to us to show to our local chapters, and make sure it's sent out to us by email to those that are participants. Thank you.
Are we recording this, Brett?
Yes, so we're recording this and we'll have it posted on veteranspolicy.org and then distribute it via our email list as well. So if you want to subscribe to our weekly newsletter and get the copy of this video, go to veteranspolicy.org.
Also, later this month, we'll be putting out a longer report on veteranspolicy.org about the staffing issues of the VA and more on how they can be solved. So there's quite a bit already on our website, and there's more coming, including you can also find our guide to both congressional staff and to reporters. There's 2 guides on the VA as kind of an long educational documents on how the VA works and how it doesn't work. And I think that if you should, they run about 50 pages each. So
I should add one more thing, if that's all right.
okay.
One thing is that on the Portland website, VA website, they just made a national announcement about the 4th mission on April 14th. So this has only become officially noticeable just recently. So we should keep that in mind also.
Thank you. So I want to thank Suzanne and Jasper for walking us through a lot of these challenges that veterans face, and especially in this time of crisis. And thank everybody who joined us today. I think we have one more question from Skip Delano, and then I think we'll call it quits. Skip, do you want to?
Yeah, I just have really carrying on from what Dan said, and I thank very much Jasper and Paul and all of you for bringing us all together like this. And just would like to say, this is such a unique time. I mean, with a crisis in the country, but a unique time to stand up for the VA and stand up for VA healthcare. Is, like Suzanne has said, it is a model for all of us in America. And while the 4th mission is something many of us are just learning about, like myself, I just was unaware of it, and it's something that even gives more strength to the argument we've got to preserve and strengthen our VA. And so that's what we need to do now, is celebrate, talk to our congressmen, our senators, and tell them that we want to end sending people out of the VA, instead give it more money, give it more strength to provide the 9 million veterans who use it, and many more of us need it in the future. So again, it's just an opportunity for us to speak out more and more about how the VA is such a strong institution, serving not only 9 million veterans, but all Americans.
I'd like to say one final thing, if I may, Paul.
Oh, all right.
Thank you. I think that there's a real message here for all our communities about, supporting this healthcare system that has really been taking a beating over the past 6 years. And this is a horrible crisis, and it's not going to be over soon. And veterans are particularly impacted by this, and their families and communities. And I know that there are groups out there who want to support veterans. And one of the ways they can do this is by supporting the VA. One of the people, I think, on the call, and maybe we might give her an opportunity to say something, she's also on our board at the VHPI, is Dorothy Salmon. And I've been privileged to work with Dorothy about with her Rotary clubs in Napa, who are trying to work to get people who are have a philanthropic attitude to give to the VA. And I think this is going to be really important in the next couple of years, because I think that with the hit the economy is going to take, you know, there's going to be a lot of drying up of private philanthropy. And if people want to support the VA and support, I mean, if people want to support veterans, they need to support veterans. They can support veterans by helping the VA through the kinds of activities that the Rotary clubs are doing. I also think what Dan Shea mentioned about getting healthcare reform activists on board. Too many healthcare reform activists, in my view, who are interested in fundamental change in our healthcare system point to Canada or the UK or Scandinavia. And we have a healthcare system that's homegrown, that's been doing a great job, and now is really stepping up to the plate for all of us. And I think those of us who are active in this movement need to be reaching out to people who are fighting for broader healthcare reform and bringing up the example of the VA, as we at VHPI have tried to do.
Thank you. There's a lot of very good and pointed questions about what's the plan for hiring more licensed certified healthcare and mental health care clinicians. There's the question of other than honorable discharges and whether the VA is going to cover that or not. And that's, there is some action, there is some movement by the VA on that, but they have yet to publish new regulations to cover OTH. And there's other questions, and I don't know, we're at 1 hour and 8 minutes into this, and I think that we're gonna need to pretty much call it quits. Perhaps in another week or two, we will schedule an additional event like this, try to keep it to 1 hour, and take some of these questions apart and put them back together. So I think, Jasper, did you have any final thoughts that something that didn't get covered or you want to address?
No, I mean, I think we could talk about the VA for a long, long time. But I think I appreciate everybody tuning in. This was a really impressive show of support, and really, I think we just covered a lot of diverse opinions and perspectives, which is fantastic. And I think VHPI should definitely do another one of these soon. And, you know, if there are other questions you have that come up in the next couple of days, you can email executive director at, or what's your email, Brad? Sorry to inundate you with emails, but you can send us stuff, go to our website, send us some questions, and we'll try to do some work to get answers and hopefully have another one of these soon.
Great. And I also want to second that we really appreciate the interest that you've all shown in this. And I'm sorry we can't get to every question and treat it with the thoroughness it deserves. So I think on that note, on behalf of the Veterans Healthcare Policy Institute and our executive director, Brett Copeland, I want to really thank Suzanne and Jasper for stepping up today and helping us through this thing. We have a lot of work to do, and we're going to be here for a long time. So I want to thank you very much, and we'll call that a day. Thank you. Now what? Thanks, Brett. Don't know what I'm doing.